The path to a more equitable and resilient world starts with healthy women, children, and adolescents. Access to essential health services and rights not only saves lives, it also unlocks opportunities. Healthy women and adolescents can go to school and pursue their dreams, find jobs, and ultimately help entire communities and countries thrive. But across communities in some of the world's poorest countries, access to critical health services and rights is out of reach. As the world grapples with new realities and ongoing crises, we are at a critical point. One where it is vital that women, children, and youth are empowered to help build a more resilient world. Through its partnership with lower-income countries, youth advocates, and health workers, the Global Financing Facility can help deliver a brighter future for women, children, and youth. It has successfully supported countries as they improve primary health care, maternal and newborn services, family planning, and nutrition. But more work is urgently needed. With continued investment, the GFF will ensure that 250 million women, children, and adolescents can access life-saving health services and help build more resilient communities. For the sake of sustainable and equitable progress, the world must stand with women, children, and youth and provide them with the opportunities everyone deserves. With support to the GFF, the world can deliver this future.
The women in the house? Are there women in the house? No. Absolute silence. Are there women in the house? Oh, yes. Now, women, we need the world to hear you. So when I say, are there women in the house, you give me your wildest and your loudest applause. Are there women in the house? The men are saying, oh, no. Are there youth in the house? No, not you, sir. You're in your 50s. Are there youth in the house? Anyone below the age of 35? Let me hear you. Last but not the least, are there well-wishers in the house? Do you want a different world? Let me hear you. And in chorus, I need you all to say, we will deliver the future. Let's go. Please, it's too quiet for me. A little louder. We will deliver the future. Is Africa in the house? Yeah. Ladies and gentlemen, my name is Anita Erskine, and do not look beyond the energy that I come into this room with. Look to the intent. I love women. I love our youth. I love men too. But more importantly, my love for women is in my trust and my belief that if every single woman is given one little tiny opportunity to live and to realize her potential, the world will be a better place. Now, I've heard people say, oh, we've given the men 200 decades, 200 centuries, this and that. Yes, I get it. And guys, we are not saying we want to replace you. We're just saying for the world to move in the trajectory and in the direction that is better for our youth for tomorrow, you need to make space. You need to make room. You need to move so that a woman can sit right next to you. And in sitting next to you, you will be inspired even more about what women can do. Now, what is the connection between what I'm saying and why GFF has brought us here for the first pledging event? It is that if you are able to commit to helping more women around the world, if you are able to say, you know what, Anita, I came in here thinking that I was going to give 10 million, but you know what, I'm going to give 100 million. The ministers are saying, we don't know about that. But if only you could see the value of what saving women's lives and giving our youth and adolescents empowerment agency means, It may not necessarily end our crisis tomorrow. No, that's not what I'm saying. It may not necessarily stop climate change tomorrow, but I can assure you it will be one extraordinary step in the right direction. So, ladies and gentlemen, together, are we going to deliver the future? Yes. You've just had lunch. I need you to wake up. Together, are we going to deliver this future? We're having a series of conversations, series of speeches, series of panel conversations. Please listen to them. Stay off your phone. That email can be answered after my program. But I need you to pay attention. And if you came here not knowing why you're here, I need you to leave feeling inspired that indeed, perhaps, just perhaps, the global financing facility is the kind of opportunity you've been looking for to help the world's women. And now, without any planning or any coincidence, but a lot of intention, my first speaker is a woman in her own right. And when I bring my women onto the stage, you better give us the resounding round of applause. Please welcome the Honorable Minister, Her Excellency, Minister Schultz. You're welcome.
Anita, thank you very much for this powerful start in this very important event. Colleagues, ladies and gentlemen, what does it mean to deliver the future? For 13-year-old Mariama in Senegal, it means that she will be educated about sex and have access to menstrual hygiene products and contraception. If Marina can avoid an unintended pregnancy, she can finish school and start vocational training. Ask about her experience with the Global Financing Facility. She said, "I can see now that I have a prospect. I want to become someone and help lift my family out of poverty. And only then I would think about marriage. Before the project, marriage would always have come first." For Mariama, delivering the future means providing her with education. For Aminata in Côte d'Ivoire, it means that she was taken care of by a midwife while giving birth, and that her children will be vaccinated against measles and yellow fever. This will improve their health and the resilience of the communities they live in. It will also have a positive impact on their education and their prospects later on in life. For Aminata, her family is her future. And these are just a couple of examples of how the GFF is supporting women worldwide in leading healthier lives. But delivering the future isn't easy, and it certainly does not come for free. In fact, $800 million need to be raised for the GFF to provide essential health services to 250 million women, children, and youth in the coming years. And that is why Germany, together with our partners, Côte d'Ivoire, the Netherlands, and the World Bank, has started the Deliver the Future campaign to make sure that this money is available and that the GFF can continue its work of saving lives, can continue to care for pregnant women, can support them in delivering their babies, can support them in planning their families and getting their children vaccinated. And it is no coincidence that the GFF focus on women and children, because women's rights are human rights. And because girls and women make up 50% of the world's population, only girls who are healthy and able to make decisions about their own bodies can grow up and become educated and self-sufficient women. Women that enjoy the same rights, the same resources and representation as men. Delivering the future to women comes at a crucial point in time. The ongoing crises are making it much harder to invest in women's health, because countries have constrained budgets and competing health priorities. On top of this, the anti-gender movement is growing internationally and trying to restrict the rights of women. And this is unacceptable, and we will not stand for it. In order to deliver the future together with the GFF, we need to do three things. Firstly, we need to raise the money required and invest it as effectively as possible. Secondly, we need to strengthen our partner countries' efforts to increase healthcare investments and unlock additional funding. And thirdly, we need to work more closely together, especially with civil society and partners at the multilateral level. Because I like to put my money where my mouth is, I am happy to announce that Germany will be providing the GFF with 25 million euros of support next year, and I will work to continue this support in the future. I hope that together with our partners we can leverage even more funding for the GFF, but by raising this money we are getting closer to achieving the health goals of the 2030 agenda. But what is more, we are helping women to shape their own lives so that women like Mariama and Aminata can deliver the future to their own children. Thank you very much.
Thank you very much. And that was Her Excellency Minister Schulz, who's the Federal Minister for Economic Cooperation and Development, Germany. Ladies and gentlemen, allow me to introduce our next speaker who joins us via video. It is the person of His Excellency, the Minister of Health from La Côte d'Ivoire, Minister Dimba. Please take a look.
Madame la ministre allemande de la coopération économique et du développement, Madame la vice-ministre pour la coopération internationale, Mesdames et Messieurs les ministres de la Santé, chers collègues, Mesdames les directrices de l'UNFPA et de l'UNICEF, Monsieur le directeur du GFF, cher Johan Paolo, honorables intervenants et invités, je suis heureux de m'exprimer devant vous aujourd'hui. Nous avons une occasion unique de nous mobiliser de façon ambitieuse en tant que communauté internationale. C'est pourquoi la Côte d'Ivoire porte avec l'Allemagne, les Pays-Bas et la Banque mondiale la campagne du GFF, Dessinons l'avenir, pour témoigner du succès de ce modèle catalytique et partenarial unique. Le modèle du GFF s'adapte au contexte des priorités de santé de chaque pays et favorise ainsi l'alignement des différents partenaires autour des priorités des gouvernements. La Côte d'Ivoire a rejoint le partenariat en 2017 et les résultats sont là. Le taux de mortalité maternelle en Côte d'Ivoire a diminué de 40%. Et le nombre de consultations postnatales a augmenté de 59%. Les défis restent cependant nombreux avec des décès évitables. Nous devons notamment garantir l'accès équitable aux centres de santé, réduire le risque financier lié à la maladie et renforcer la qualité des soins. En tant que coparrain de cette campagne, je suis fier d'annoncer que la Côte d'Ivoire est engagée pour réduire sa mortalité maternelle de 18% d'ici 2025. Nous nous engageons également à réhabiliter et construire près de 1000 centres de soins de santé primaire. C'est pour cela que mon pays a mis en place 10 pôles régionaux de santé pour assurer le continuum de soins sur l'ensemble du territoire ivoirien, réaffirmant tous les niveaux de la pyramide sanitaire. Le leadership sanitaire commence par celui des pays et nous sommes prêts. J'appelle donc tous les partenaires du GFF à redoubler d'efforts en investissant davantage. Et j'invite de nouveaux partenaires à rejoindre le GFF pour que davantage de pays puissent bénéficier de ce partenariat. C'est notre responsabilité. Nous comptons sur vous aujourd'hui et dans les prochains mois. Je vous remercie.
Ladies and gentlemen, the big question, why now? Why are these resources crucial at this point? I wish I had the answers, but I do have a panel that's going to come and describe, explain, and get you to accept why these resources are necessary to delivering better rights, representation, and resources. Please allow me to bring to the podium Christina Chilimba, who's the founder All for Youth. Christina, where are you? Please take a seat. not where my name is, anywhere else. Please also welcome the second in my panel, Juan Pablo Uribe. Juan Pablo is the Director, GFF and Global Director for Health, Nutrition and Population, World Bank. Last but not the least, joining us virtually is Her Excellency Pascal Grottenhuis from Netherlands. All right. Now, let me tell you, by now you know I'm harmless, right? Very easy questions. Your Excellency, you're very welcome. We miss you. But we're also very grateful for the Netherlands' commitment to the GFF. So, Christine, I'm starting off with you. You are the youngest one amongst all of us, I mean, after me. I'm 25. But I really, do not laugh. I really want you to talk about being young, that representation, and why you feel that it is fundamental for countries not only to build plans, but to build plans that have youth at the center, youth at the table.
Thank you very much. Honorable ministers, esteemed guests, thank you for having me here today. Like I said, I think yesterday, all of us here have been young. As I speak, I want you to take yourself back to that age, when you were 13, when you were 14, when you were 15, and not having someone listen to you, not having that adult understand your needs. Why did I start All for Youth? Exactly that. I realized that young people were not aware of the policies. There was no bridge. We would ask what we need, but there was no listening ear. Then I realized young people need a platform. I was privileged to undergo mentorship programs, and I realized how best can I give back to my community. I created a platform for young people to be able to understand the policies that concern them. So I started All for Youth. Brought in young people from various backgrounds, including refugee youth, told them about the policies concerning sexual reproductive health and rights. And I realized there was a gap, linkages to care. You want them to demand, but demand to who? Someone they must know, someone who must understand their needs. I created linkages with healthcare providers at facility level and tried to also lead advocacy at a national level with the support from the GFF by the leadership of my government, Government of Malawi, Ministry of Health to be exact. I have worked hand in hand with them. They've been welcoming in terms of understanding our voices and bringing us on the table. And with that, I realized, let me bring a lot of young people to the space. They should know their rights. They should be able to create linkages to be able to demand for the services that they need. What am I saying here? Young people cannot be ignored. We cannot be ignored. If you're talking about conversations in tech, talk about education, gender, health. You cannot go forward without the youth voice in those spaces. I mean, clearly we are here delivering the future, planning for our tomorrow, where I will be a leader tomorrow to lead those policies. The pledges we're making here today are for me to follow up through and make sure that my sisters back home really have access to contraceptives, to have autonomy over their bodies. This, ladies and gentlemen, is very crucial. Thank you.
Thank you very much. And spoken with a lot of passion, Your Excellency, I'm going to come to you. I mean, you felt Christina's passion right here. And I know that the Netherlands has also been very, very passionate, a proponent of a rights-based and country-led approach. Tell me what, in practice, this means. And ultimately, perhaps how donor governments are working, with countries, especially knowing that the world is changing by the minute.
Thank you so much, and I first would like to apologize to both the ministers, but also to Christina and Juan Pablo for not being there. It's the very unfortunate and awful crisis in Israel and Palestine that's keeping me here, but in spirit, I'm definitely with you. And for me, it's an honor to be speaking after Christina. Thank you so much for your powerful and inspirational words, Christina. I think you're so right. We should always ensure, especially when we're talking about the future, that we not only invite young people, but that we listen to them and engage them in a meaningful way. And I think having a youth at heart strategy and also having a feminist foreign policy, it's an honor to be here, and it's an honor to be speaking together with Germany, Ivory Coast, and the World Bank. I would like to say that they're not only co-hosts of this campaign, but also super big champions for women's and children's health and rights, and key leaders to put this agenda forward. I think what you just said, I think when we talk about the context in the world, I think SRHR is essential in helping young people making informed choices about their health, their bodies, and their lives. Choices about whether, when, and with whom they want to have children, and how big they want their families to be. And choices that can drastically change the course of their lives, and their children's lives, and societies as a whole. So for me and for the Netherlands, gender equality and SRHR are key conditions for sustainable development. I think if we look around in the world, SRHR remains a taboo subject in many countries. It's being politicized, also within the European Union, but also abroad. And we witness a rollback of these established rights. And for me, it proves that sexual and reproductive rights can never be taken for granted. So what it means for us, I think for Netherlands as a donor country, to have a country-led approach, it's essential to achieve sexual and reproductive health and rights. Meaningful participation of partners, like young people, CSOs, in decision-making processes and program design is key. It might be uncomfortable in the beginning, but it's absolutely essential for the sustainability in the long run. And this is what the GFF does. It supports country-led approaches to ensure sustainability. It integrates SRHR as an essential part in health systems, and it focuses on meaningful participation of partners in the country's decision-making, including the CSOs and the young people. And I think that's what we mean when we are committed to leave no one behind. We know that the GFF model is working. 72% of countries that received support of the GFF for 5 years or more improved most essential care service. And in 8 years, more than 500 million women have received access to family planning. And with that, I believe more than 180 million unintended pregnancies are avoided, giving women the right to organize the lives they want to have. So all this is why the Netherlands has decided to triple its core contribution to 90 million euros and to add an extra 10 million for Ukraine, to support engagement in Ukraine, to restore access to essential health services for women and children. Thank you.
Well, I have to say you have set the ball rolling on this. Tripling, ministers, you hear? Tripling. Now, I'm not here to only just say, oh yeah, that requires a round of applause. But I'm not only here to state what is being pledged, I'm also here to say we are a little past halfway, but we need to get to that 800 million. But one, I bring you here to tie all of this up very beautifully. We understand, and now we know, we are convinced that GFF is the way. But why is it key for it to sit at the World Bank, and how does it help countries, highlight and stay in line with their priorities?
Anita, thanks so much, and thanks for your energy and for being also a super champion. Like everybody in this room, that's why you're here. I'm very happy to that. Of course, a huge thanks to our co-host, to Germany, to Netherlands, to Côte d'Ivoire, but again, to each and every one of you who are here. And by that, you express that this is important for all of us in development. Christina, a very particular thanks to you. Amazing to be sitting by your side. I also believe that I'm the youngest here, but you won't believe it. But after hearing you, maybe I'm not. You have so much strength, and thanks so much, because civil society, your leadership, your advocacy means a lot at the country level and in the GFF model. So thank you so much. To your question, Anita, and I will just bring some examples. Something nice about the GFF model is that each and every of us as partners can bring our best competencies, our best skills, and they all come together and complement each other around the country leadership. In the case of the World Bank, of course, the first thing that is important by hosting the GFF is that we can leverage all the bank resources, in particular at the country and regional level. I'm talking, of course, about our staff and their knowledge and their technical capacity, the policy dialogue that is permanent with the governments, and of course, as you would always expect, the financing resources. The GFF is very good, as Minister Dimba said, in being catalytic and leveraging those IDA resources and even IBRD resources. Just to give a number, which I think means a lot in terms of health policy, those countries where the GFF is working are able to pull 40% more resources from the World Bank into women, adolescents, and children's policies. So that's extremely important. In addition to those resources, it's also important the work that we do in enabling environments that support the development and the future of women, adolescents, and children. With UNFPA, Natalia, we're doing incredible work advancing legal reforms that really protect the rights of women and adolescents around sexual and reproductive services and rights. Keeping girls in school, for example, which is something so important, will be defended by those legal reforms and better environments. And lastly, we can also help bring in the GFF innovations to scale. A beautiful example is in Tanzania, where led by the government, innovations that are also brought together with partners from the private sector, Lardao in this case, have been able to work in 5 provinces with over 250,000 women and new services with enhanced skills for newborn care. And with that, the impact on mortality has been amazing. What follows? Taking it to the whole country, taking these innovations into the whole country. Let me finish basically by saying that this is a moment of happiness. We need moments of happiness and hope. For me, this is one. This is a moment where we can all join efforts. This is a moment in which we can all work around country priorities, strengthening that country leadership, which is so important, strengthening the institutional capacity behind our health systems, and foremost, and those of you who have heard me, I repeat this again and again and again, maintaining this agenda of women, adolescents, and children visible. It's them, it's the women, the adolescents, and the children who bring hope for all of us.
Thank you so much, Juan. Beautifully said. And you've segued right into what I would call the last part of this conversation. I've got only about 5 minutes. But Pascaline, I throw it to you first of all. What must we do? What's the next big step that we must all take collectively to make sure that we are on that same path, that same trajectory together towards what we define as success?
Thank you very much. I think there's a lot of things at stake. So I think established SIHR rights are under pressure. And we should help countries to ensure better rights and opportunity for women and girls, particularly in the hardest to reach communities. Because for countries to prosper, we need to invest in women and girls. Secondly, inequalities are rising. And I think we should ensure that we are on a path to deliver the future that is fair and more equitable for everyone. And then lastly, I think with all the crises around the world, investment in health are under pressure. And we should invest seriously in the ability of countries to shape their futures based on their national plans and their priorities. And that is why, on top of the 90 million that I just announced, we will launch another 10 million for Ukraine to help support them in the health sector.
Thank you, thank you, thank you, thank you. We've got a minute to go, okay. Christine. Your top 1 or top 2.
Okay, thank you very much. I think quickly, we must all have an increased understanding of the true barriers to progress, excluding young people, neglecting our needs, prioritizing our needs. So what do we need to do moving forward? It's now time to move from talk to action. This platform is the action for the future. I urge you all to join us in moving from just talking to action, pledges that we are making here today must be realized quickly. We are running out of time. We are running out of time. So it's time to put the youth into use. We are here, we are ready to be used. She spoke of Aminata, Mariama, those are my friends. Give us a hope, give us a future where we're going to flourish. Thank you.
Juan, I give you the last word.
No, I think that should have been the last one, but very quickly, again, I would insist that this is an opportunity for changing a lot of country realities working together. Let me just bring an example, primary healthcare and community health working together with many of you. I think we will hear about this in the upcoming panels. But again, and as Christina and Vice Minister Pascal said, I think this, what is at stake, is basically, again, dignity and hope for all of us through women, adolescents, and children. So let's work together.
Ladies and gentlemen, a round of applause for my panel. Thank you so much. Thank you for joining us. Thank you very much. Now, although he couldn't join us in person, he has sent his words to inspire, to move, and to get all of us to rethink the concept of financing. Please take a look at the screens for the words from the Director General of the WHO, Dr. Tedros.
Excellencies, dear colleagues and friends, at the United Nations General Assembly in New York last month, world leaders recommitted to driving progress towards universal health coverage. The latest data show we have a long way to go. More than half of the world's population, about 4.5 billion people, are not covered by essential health services. An estimated 2 billion people experience financial hardship due to out-of-pocket health spending, including nearly 350 million people who face extreme poverty. Since 2016, there has been no progress in reducing maternal mortality, one of the key indicators for universal health coverage. And although progress has been made in reducing childhood deaths, an estimated 5 million children a year never reach their 5th birthday. Expanding access to services for sexual, reproductive, maternal, newborn, and child health is urgent for reversing these trends. Around the world, WHO is supporting countries to do just that, and the Global Financing Facility is a vital partner in this work. We urge all partners to invest in the GFF for a healthier, safer, fairer world for all women, newborns, children, and adolescents. I thank you.
Ladies and gentlemen, when I said I was young, you all laughed. But trust me, I have been young before. But I wish I was young in an era where I could speak up the way I'm speaking up, not just for myself, but for the generation that I belong to and the number of young people whose lives could change if I just found the power and had the initiative to stand up and speak. And so it is with pride and so much joy that I bring to the podium a young voice, and not just a voice, but a mover and a shaker. Ladies and gentlemen, please welcome to the podium our youth advocate, Chedu Moyo.
Congratulations, 21 million girls aged 15 to 19 years of age become pregnant each year. In Zimbabwe, 1 out of 4 girls are going to become pregnant before their 20th birthday. 10 years ago, this could have been me. I turned 25 yesterday. See, I grew up in Ngwanyana, a very small village in Plumtree, Zimbabwe. This is a dry community with very arid winds, very unforgiving droughts, and the mirages of water that signify the struggle of the girls and women in our village. At only 5 years old, I lost my father. In our village, that meant that my 3 sisters and I were exposed to forced motherhood, early marriages, sexual exploitation, and even violence. Now, the resilience of our mother, who has always been adamant about changing the tragic narrative, made sure that my brothers, from a very tender age, understood the value of respecting women. Through collecting and selling mopane worms, she raised and educated all of us. My mother instilled in me the value of education, which drove my determination, lending me a full scholarship to study in one of the best Catholic schools in my region. My mother's dedication wasn't just confined to us. As a village health worker, she was the beacon of hope for many. With basic supplies like pain relievers, condoms, and the ever-trusty bicycle, she was and still is the lifeline for those in need of medical services in my community. See, I was just 12. I was just 12 when I had the privilege to be an assistant, writing referral slips, sometimes secretly passing condoms and contraceptives to the youth who felt more comfortable talking to me. At 15, I was already seeing the gap and what a game changer access to SRA-HR could have in the communities. So, at the onset of the COVID-19 pandemic, at the age of 21, I started a WhatsApp group to share where young people could access services and where they could get help in terms of SRA-HR. The response from the young people made the WhatsApp group to evolve into me creating the Lunia Center for Youth. I'm proud to say that today, the center has trained over 40 youth-led organizations on how they can participate in national health processes for improved health services in Zimbabwe. We also advocate for the implementation of SRA-HR policies in our country so that we can have improved access to health. And we use evidence-based research to establish even the nexus between climate change and SRA-HR. This is why our partnership with the GFF is so critical today, to keep planting the seeds of our initiatives deeply into the communities that we serve. We need you to step up. We need you to step up to ensure young people in places like Ngwanyana fully access rights to sexual reproductive health and rights. And it starts with empowering them with sexual reproductive health and rights services. I share your urgency, but this also comes with impatience. The clock is ticking, and the longer you wait to act and finance as donors and countries, even more girls are missing their right to health. And with that, lives are cut short and potential goes unfilled. Honorable ministers and esteemed guests, the 21 million girls cannot afford to wait. We have too many commitments and strategies. We need to deliver the future now. Thank you.
Ladies and gentlemen, the youth have spoken. We have too many strategies. We have too many plans. Let's put them into action. And talking about a little bit more action, let's focus on innovation and collaboration to deliver rights and opportunities. My next panel discussion comprises 3 extraordinary women. Please welcome the Honorable Minister of Health from Liberia, Honorable Dr. Wilmina Esjala, joined by the CEO of Save the Children, Inga Ashing. Last, definitely not the least, the Executive Director, UNFPA, Natalia Cannon. Hello, hello, hello. Ladies, how do you feel?
Good.
We need an hour, but unfortunately we have only 12 minutes. Can we do this in 12 minutes?
Sure.
Let's show the guys the way the girls do it. Now, let's start off with you, Honorable Minister Wilmina. I'm looking at the concept of sexual and reproductive health and rights in primary health care, and also thinking about this international community. What does the international community need to do to remain laser focused on achieving this?
Thank you, Anita. I'm very delighted to be here, even though my mind is here, but my whole body is in Liberia because of the election results that is currently going on. But, you know, GFF have been one of the organizations that have really helped reaching, you know, the hard-to-reach area. Their funding is not restricted, so you can do a lot more with what they gave you. But for us to remain laser focused on what we are doing, we must make sure that we engage our youth and our CSOs to make sure that they are speaking to us and to each other. That's one of the important things that we have to do. Also, we must have adequate financing because without the proper financing, there's nothing you can do. For Liberia, the government, in its own weak way, have announced a 5% increase in SHRH services in terms of funding. But, you know, this is an annual thing, so we are going to be increasing that funding. We also need to keep focus on the SDGs because we're all reducing maternal mortality, we're all reducing child mortality, increasing nutrition, and all of the things that we have to do, then all of what we are collecting, all the money they are raising will be in vain. We have to reach those vulnerable populations across the waters, in the different alleys, or women that are so far away from services that they need to be and carried to facilities per hammer. Those are the people that we are focusing on. So we need a lot of innovation in terms of legal instruments to make sure that what we say is what we are going to do.
Honorable Minister, I know that, you know, I shouldn't put you on the spot, but I should let you underline. You are promising 5% increment.
Yes.
Say it in your own words, Honorable Minister.
Liberia have committed a 5% increment in SHRH services.
A round of applause for Liberia. So Inga, you heard the commitment. You understand the challenges because you have literally committed your life to this. From your perspective, how is this conversation changing? What are you seeing about the shift? And perhaps maybe can you see the future? Not literally, but given what you do, can you see where all this is going?
Yeah, thank you for that question. And yes, I've spent most of my life focusing on this. I also started as a child activist at the age of 12, and I'm still around. And when I speak to children today, they are often very frustrated over the inequalities that they experience or see around them. I spoke to a 14-year-old girl from DRC, Rose, who told me that being a girl means that she has less rights than the boys around her. She has to fight to be allowed to continue her education, and she has to fight not to be forced into child marriage. And that is the reality, as we know, for many girls around the world. And we have a lot of challenges. But we also have a lot of opportunities. And I think Christine and Chedu just showed us that a different path is possible, mainly because a lot of women and young girls are now speaking up in a way that they didn't do in the past. So I think that there's a lot of things that has happened and gives me a lot of hope for the future. We're also seeing a lot of even if there are a lot of pushbacks when it comes to women's rights, children's rights, we're also seeing a strong fight back. We have a lot of improvement in the promotion of women's rights more broadly. The emergence of feminist international development policies is one example, and that is one way that several governments have decided to show political leadership in this space. And I do think if you look a bit longer, have a longer perspective, I think the whole conversation on women, children and youth rights have moved from being recognized to actually focusing on empowerment in a way that I haven't seen before. And so that is positive, but there is a lot of challenges, a lot of, and I'm sure Natasha will tell us more about that, but
Major obstacles to women and girls fulfilling their basic rights to education, protection and health. We know that girls are increasingly at risk of gender-specific threats and violence, such as child marriage in crisis, which I think is very relevant to talk about at this particular time, is we know that adolescent sexual reproductive health rights are rarely prioritized, and social-cultural norms are often being the barriers to accessing these sexual reproductive health services. As Save the Children, we work alongside children themselves with partners in government to create system-wide change. And our programs engage children themselves, their families and their communities to promote more equitable social and gender norms and behaviors. And as we've heard both Christina and Shedu say, I mean, we need to have not just youth, but also children at the table in order to actually respond to the actual need, not the perceived need. So I think that is really, really critical. And we are, in many places and in many parts of our work, seeing a change in actual empowerment, in actually inviting them to the table. The final thing I just want to say is that since we know that the challenges are huge, I really want to also take the opportunity to call for more investment in this agenda. In order for us to actually make the change that we know we can make if we come together, we need to come together. And I've heard a lot of people in the past few years talking about increasing constrained and financial and fiscal space for this area. And it is putting many organizations, many of us in the room, in a position where we need to do more and better with less. Yeah. And that's why I think the Global Financing Facility is so critical in ensuring that we are prioritizing together, that we are focusing, working closely with the governments, with the local NGOs, aligning to national priorities. And that is what I think will help us through in this critical time. And we can, if we choose to, come together and really respond to the challenges that we've heard and the challenges that so many girls and young women are facing around the world.
Thank you very much, Ingrid. And Natalia, I can't deny the fact that it feels like the challenges are truly the elephant in the room. And I would like you to highlight what you believe the biggest hurdles to sexual and reproductive rights are. But on the other side, what then are the opportunities for countries and partners?
Well, thank you very much, dear Anita, dear ministers, excellencies. For UNFPA, which has been involved with the Global Financing Facility since inception, we see this session, which is actually talking about delivering rights and opportunities, as a clear signal that there are things that we can do to address the challenges, which I will list in an abbreviated fashion, but also that prioritizing the needs of women and girls is as essential as any other type of medicine that is going to heal a troubled world, a world that needs peace, and women to lead that. For what we have and what we're looking at right now, I will say that the 4 challenges, and each of these can be overcome, begin with attitudes. Who matters? Who's important? Who are we going to worry about? Who are we going to put at the top of the list? Women and girls belong at the top of the list. This is why the rights equation is so important, to demolish the taboos that are going to leave a girl in ignorance, and then we're going to blame her when she, quote unquote, falls pregnant, and we're not going to ask how it happened. We're just going to toss her out of school, truncating her education and not just her economic fortunes for herself, her family, but into the next generation. Now, these attitudes also include the pushback, which Inger and others have already addressed, which say that we should be quiet when women's rights are being pushed back. Absolutely not, and I think we need to be vocal and visible and insistent. The data is there, the evidence is there, but the power of persuasion that says, Women's rights for equality cannot go backwards. We're moving forward. This is what the GFF Pledging Conference, to me, symbolizes. Are we going to put our money where our mouth is? And part of that pushback is the inequality within. In the best of circumstances, who is being left behind? This is what the Sustainable Development Goals invite us to look at. For women of African descent, for LGBTIQ people and sexual diversities, for a whole host of reasons, people with disabilities are thought to be unworthy of what? We all have equal rights, and this is what we are here to assert. Now, the second problem coming up after attitudes is the systems. The systems that were never designed for good health, preventive health, primary health. Juan Pablo has reiterated time and time again, we saw in COVID how the system was really not set up for delivery. And if you are caught up in a humanitarian conflict, as so many are right now, who is thinking about your menstruation? Who will be there to provide your dignity kit that contains your contraception? All of these are things where the systems are illogical by design, and we can do something about this. Next obstacle is what I see as the health workforce. You know, it's almost 3/4 female. In this sense, we also have to remember that there's a lot of invisible, unpaid health workforce. You looking after your elderly parents. The girl who, as we've heard, is working with her brothers and sisters in isolation. The huge mental health consequences of everything that people go through. And we haven't equipped social workers or therapists or whoever to deal with post-traumatic disorders. So let us look at a health workforce that needs to be reorganized so women and young people can get what they need. And lastly, resources. The obstacle of resources is one which the human family can certainly overcome. And what I see as the levers to tackle these, hashtag body right, full bodily autonomy for every person on the planet. Let's start with that. Hashtag midwife. Right now, there's a woman in labor wondering, is the midwife going to come on the donkey, on the boat, wherever you are in your riverine community? Midwives save lives, and we've got to double the number of midwives before 2030. And my last plea has already been eloquently stated by others who came before. Let young people lead. Let us allow them to lead us in the direction that says serenity, peace, harmony, dialogue. Thank you so much, Anita.
Thank you. And ladies, we have only a minute to go, so I'm going to give each of you 30 seconds, and I apologize for the time, but 30 seconds to give me your thoughts on the innovations and partnerships needed to address the magnitude of challenges we're facing. Maybe one from each of you, please. Honorable Minister, we can start with you.
For us, we need to have our legal instrument passed that will give women the rights to safe abortion, give the girls the right to go to school, and give the right menstrual hygiene, especially that situation. I would like to thank GFF for their support and the partners that are here that are supporting GFF for this future endeavor.
I think it's very much about working, finding new ways of working. And just to give you one example, in West Africa, we have implemented projects that involved teaching trainers in menstrual hygiene management. We have rehabilitating wash facilities, and we have also partnered with social enterprises and local producers of menstrual pads to promote sustainable and affordable supplies. And I think it's that way of ensuring that it's not just the burden of the girl, it is the whole community around her that needs to be involved. And we need to find new ways to work together, to find new solutions, and partner in a different way.
Thank you. Natalia, I guess you have the last word.
Yeah, I think for me, again, GFF exemplifies the type of partnership that makes a difference. Under the umbrella of universal health coverage, we have to innovate in terms of health insurance. We have to innovate in terms of local communities. GFF is country-led. It's in the hands of ministers who know exactly who needs what and where. But the behavioral innovations that we need to look at in terms of attitudinal change, I think this is an aspect of innovation that leads to broader systemic forces shifting. So I'm really looking forward to that in the next phase.
Ladies and gentlemen, a round of applause for my panelists. Thank you very much, Honourable Minister. Thank you, Inga. Thank you so much. And now, for our pledging moment, I would like to give the floor to our partners, the United Kingdom, and we'll start off with a video, and then, of course, it'll be followed by Mr. David Winray, who will share some words. Ladies and gentlemen, the Right Honourable Minister Andrew Mitchell joining us via video.
Good afternoon. It's a privilege to address this important event, and I am so sorry I can't join you in person. The Global Financing Facility plays a key role in the UK's work to end the preventable deaths of mothers, babies and children by the end of this decade. This is an ambitious, powerful partnership, one that's dedicated to improving the health of women and young people around the world. That's why we have been glad to support the facility since 2017, and the benefits of that investment are clear. Together, we have supported countries in their ambitions to improve reproductive, maternal and child health. And we have promoted an integrated health system approach to improve the effectiveness of investments. We have made progress, but further advances are far from guaranteed. Rather than seeing a concerted global effort to ramp up support to women and girls, we are seeing gender equality and sexual and reproductive health and rights being rolled back. Maternal death rates are stagnating or even being reversed. And we have seen how women and girls can be the worst affected by crisis and disasters, then left behind when it comes to the response. Amid all this, global health systems are feeling the strain amid growing demand. We need to act urgently to get on the front foot and save lives. And this replenishment is an opportunity to do just that. I am pleased to announce the UK's new commitment to the GFF for a further £80 million of funding over 5 years from 2025 to 2030. This will help the facility to build on its successes, deepen its support across 36 countries, and expand to new ones. I look forward to working with all of you in partnership to build a fairer, healthier world for generations to come. Thank you very much.
Well, thank you very much, Chair, and you've just heard the good news from Minister Mitchell on the UK's 80 million commitment to the GFF. I just wanted to briefly reiterate the Minister's message on the importance of the UK GFF partnership for delivering on our agendas to end the preventable deaths of mothers, babies, children, and to improve women and girls' health. Ending the preventable deaths of children is the focus of the Global Food Security and Nutrition Summit that the UK has announced, and the GFF is a good example of how integrating nutrition into health systems can build resilience to food insecurity and famine. But our continued support also reflects a recognition of the GFF's unique successes over the past 8 years, and we did not make this replenishment in isolation. There are a number of important upcoming global health replenishments, and we would like to look at these moments to deliver steps towards change that our partner countries are asking for. We want to support reform of the global health system so it is fit for purpose, And it's particularly important that we are putting country leadership and priorities first, strengthening health systems and primary healthcare globally with an integrated health approach, promoting sustainability from the outset and ensuring our health investments coordinate with each other, and importantly, reaching the most marginalized and women and girls. And our commitment to GFF is an important piece of this strategic global puzzle. And despite being a relatively young initiative, the GFF has achieved a great deal already in these areas. It's helped countries to improve on key indicators for women, children and adolescent health, and has increased the amount of World Bank IDA loans for these areas. And the GFF is mainstreaming important issues, as we've heard, of gender equality and SRHR, given the rollback we're seeing. And its model crowds in resources around country plans and supports health finance reforms to improve funding efficiencies. But we think the GFF can do more. The GFF and the World Bank are codependent, and this relationship can be further strengthened to ensure results. So greater coordination at country level is essential to maximize efficiencies across health investments, and the GFF has a central role in promoting this through global partnerships and also at the country level by learning from models of collaboration already in place and taking them to scale, working with other GHIs and UN agencies. And the GFF can also encourage more climate resilience and responsiveness within the health sector. So finally, we welcome the independent evaluation planned for 2024, but in addition, constant self-reflection and analysis are critical to a successful model. So if these and other refinements are successful, I'm happy to announce that the UK will add an additional £18 million to the £80 million pledge made by the Minister today. That takes us to £98 million or $120 million. Thank you very much for your time.
Thank you, David. Oh, I like the sound of money. 120 million US dollars. Please, a round of applause for the United Kingdom. Thank you so much. And now, please allow me to bring to the podium the ambassador of Italy in Germany, Ambassador Armando Variscio. You're welcome.
Good afternoon, everybody. Thank you very much for the invitation, Minister Schulze, dear members of governments, excellencies, ladies and gentlemen. Thank you very much for inviting me to address you, but particularly for giving me the opportunity to listen. Many inspirational comments, but for sure will be listened carefully. I can tell you that global health is a traditional priority for my country. The Italian cooperation is active on the ground, also through a wide network of civil society organizations. And particularly Italy devotes the highest priority to primary health care and maternal child health. Achieving universal health coverage means strengthening primary care, as 90% of essential health interventions can be delivered in this setting. Moreover, 75% of the projected health gains in the context of the SDG could be achieved through primary health care, including saving over 60 million lives by 2030. And this is why Italy has made these topics a priority in its G20 presidency in 2021, notably in the field of pandemic preparedness and sustainable health financing. The G20 Joint Task Force on Health and Finance was created then, and it further led to the institutionalization of the Pandemic Fund, of which Italy is the fourth contributor. Italy devotes a particular attention to universal health coverage, also by strengthening health systems, especially in Africa, an area of strategic priority that we want also to make the priority of our incoming G7 presidency. More resilient, equitable and sustainable health systems are the real safety net to protect the most vulnerable from emerging health emergencies. And Italy supports this key priority also within the engagement to global health-related funds, programs and partnership. I mentioned our incoming G7 presidency, where global health will be a top priority, with specific focus on global health architecture, long life prevention and healthy aging, and One Health approach, including antimicrobial resistance. Italy does recognize the importance of promoting the health and rights of women, children, and adolescents above all, through the support and strengthening of inclusive and resilient health systems. In this framework and in such a capacity, these strategic objectives are coherent to the activity of the Global Financing Facility for Women, Children, and Adolescents. So it is in this spirit, and giving you a rendezvous to the Italian G7 presidency next year, that I wish the best success for this initiative and for the GFF. Thank you very much.
Ambassador, thank you so much for sharing those words with us. And now, talking about words, it's essential to understand the transformative public health care system and essentially what our communities need. Please allow me to bring to the stage to have this very quick spotlight conversation the Honorable Minister of Health from Ethiopia, Honorable Minister Leah Tadesse, joined by the Minister of Health from Malawi, Honorable Minister Kandodo. Last, definitely not the least, please allow me to bring from USAID Assistant Administrator Atul Gawande. You're welcome, you're welcome, you're welcome. Ladies and gentlemen, Atul, how do you feel amongst these women?
I feel so lucky to be here.
You feel safe?
Thanks for including me.
Thank you so much. Now, I would love to start off with the concept of success from the Ethiopian perspective, from the Malawian perspective. Let's talk about, having to prioritize strengthening primary health care and the tremendous results, perhaps, that you've each seen. Perhaps we start off with you, Honorable Tadesse from Ethiopia.
Thank you very much. I'm glad we're talking about the foundational issue of primary health care. And for us as Ethiopia, looking back maybe 15, 20 years ago, we've had huge burden of mortality, maternal, newborn child mortality compounded with disease mortality from infectious diseases. And the government made deliberate commitment to invest on primary health care, given that we have a large country with large population, dispersed geography, which required a different way of investment in terms of how to access health to make it closer to the community. So with the investments made by government in collaboration with partners, it started to, the first focus was on investing on the community health program, community health extension program, which brought preventive and promotive services with some basic curative services close to the community. And this was really allowing mothers and communities to have access to family planning, immunization, antenatal care, and even diagnosis of and treatment for infectious diseases like malaria very close to their communities, but also investing on the linkage of services, not only at the community level, but primary health care centers and primary hospitals, which provide more package of services accordingly, again, close to the community. And this was, particularly the community health extension program, has had huge impact on the mortality and morbidity of mothers, children, and also infectious diseases, with around 40,000 health extension workers, mostly female, trained and made part of the regular workforce, paid salaried by government. And this has reduced maternal mortality from around 860 in 2020 to the current UN estimate of around 260 per 100,000 laborers, which is a huge impact, and also reducing child mortality. And the huge impact of access to immunization, which also reduced child mortality from about 97 per 1,000 to 47 currently, and access to family planning, which is a very cost-effective and, again, key intervention for maternal mortality from around just 6% to 41%. And those were made possible because not only because the government and donors invested, but they invested aligned on a one national plan, so a one plan, one budget, one implementation approach basis. So, of course, it's a continuously evolving and still facing huge challenge which needs increased investment, but we have seen this approach on investing on primary health care, especially in a way where government and donors align on one plan, one joint plan, has had huge impact. And I think the approach has been, again, had more progress with the approach that we've had or support that we had with GFF, because this is the approach that GFF is pushing forward as a catalytic fund with the countries on the front.
Thank you so much, Honorable Minister. And I bring it to you, Minister Chiponda, to talk to us about the Malawi experience in the same vein.
Thank you so much for the opportunity. Our stories, they'll sound almost similar. I think for us, for Malawi, I think the biggest challenge was that over 70% of our population, they're in the rural areas. And some of the areas, they're really hard to reach areas. Up to now, we still have women, even the youth, they have to walk for over 10 kilometers just to have access to basic, the things we have been talking about, family planning, immunization, things like those, they have to walk. So those are the challenges which forced us to relook at our service delivery and see how best did we assist our people, how best do we assist the women and even the youth. So now what we have done is that we have a new health sector strategic plan, and basically it talks to what our Honorable Minister of Ethiopia has said, that we have one plan and one budget and also one monitoring and evaluation. Basically what we are emphasizing is that we have to strengthen primary health care. And the issue is that you have a woman somewhere, maybe in Lilongwe. This woman, we have invested so much in terms of HIV and everything else. But this woman cannot be supported on issues of mental health. This woman cannot be supported on issues of NCDs. So we had so many vertical programs focused on diseases, but not on the woman. The same with the youth as well. So we are saying, our partners, vertical programs, we are doing very well. HIV, Malawi is one of the top, performers, achieving the 95. TB, we are doing well. These other things we are doing well. But what about these other programs which really nobody is talking about? NCDs, nobody's talking about those things. We still have neglected, but we also have issues, re-emerging issues, measles, we are still battling cholera, and nobody is supporting those. So that's why we're saying, no, let's strengthen our primary health care in the communities. What do we do? Increase health care workforce. We have now at least recruited about 12,000, which is still not enough, but we have managed to put each and every community health care worker on a government payroll. They are civil servants. So the community, so this cadre, which works in the community, the nurses, assistants, the midwives, technicians, they're also what we call the health surveillance assistant. And we have integrated all our services. If you're going to go to a village, you have malaria, you have family planning services, you have a kit for vaccination if there needs to be vaccination, you have preventive brochures, whatever, community engagement and what we have to do for promotive health as well. So this one person will not just belong to HIV program or TB program, no, they'll have everything. And that is going to improve the services at the community level. Let me stop there for now.
Thank you so much, Honorable Minister. And it's so heartwarming to hear about the progress. Atul, the reality of it all is yesterday's challenges, which is 15, 20 years ago, may have some similarity to today's challenges, but we can see that there's a difference. From where you sit, how do we transform the way we strengthen finance and deliver primary health care?
I'm so glad you put the context of the last 20 years, because I can't see these women leaders without thinking back to 20 years ago and what they were facing and what has happened and where we go from there. So just 20 years ago, because of HIV in particular, life expectancy had plummeted across Africa. In Malawi, it was down to 47-year life expectancy on average. And the United States was part of joining a movement around the world and trying to lead a movement around the world that said we had to give like we've never given before. And we have put billions of dollars through programs like PEPFAR, backing organizations like the Global Fund. We're the largest donor and shareholder for the World Bank. We have, and that focus was on making sure we were addressing these diseases, HIV, TB, malaria, maternal and child health, immunization, and so on. We also saw how critical it was to back family planning, and we've become the biggest bilateral donor of family planning across the world as well. But 20 years later, we've seen the differences in the countries that did it by building on a scaffolding of primary health care, putting community health workers at the front lines, enabling them to be trained, paid, and supported and integrated into a primary health care system so they're touching every home, making sure no one got left behind, providing the preventive education, and getting people into the system. The result of that is that a place like Malawi has added 19 years of life expectancy in the last 20 years. It is now past 65-year life expectancy, which is extraordinary. And the system that Minister Tedeschi described, Ethiopia, on less than $50 per person per year, is now achieving a 70-year life expectancy. Low-income countries are usually 63 or less. And that's because of that building on the primary healthcare system. So in the US government, that has meant we have had to make a major change. We're famously about these vertical programs and hear from these ministers saying we need to be aligned with their country plans for leadership on building those primary healthcare systems, paying those community health workers, et cetera. And so we have backed that effort in a couple of ways. Number one is we have aligned with the Global Finance Facility and made an agreement with the Global Finance Facility that when they're investing in these plans, we will bring our investments behind those efforts, because the World Bank and Global Finance Facility together are bringing more money than, to primary health care than just about anything else. And then the second thing is we are now announcing today, it's been a challenge working for us with the Global Fund because we have so many restrictions on how to use US aid. But we have worked out a way so that we are opening an umbrella agreement to establish a multi-donor trust fund that enable us to support the Global Finance Facility for strengthening primary health care. It is starting with an initial contribution of $4 million from global health security funds, because we believe that primary health care is the same people, the same health workers who provide the family planning, who provide the childbirth, who provide the immunizations, are the ones who are responding in a crisis. And so that is vital. And then that is an initial contribution into an umbrella fund that we've established of up to $90 million. And we will continue to raise funds to meet those, towards that umbrella.
Up to $90 million, that is what I was waiting to hear. But I'm still grateful for the $4 million. I would like to ask each of you this question to round off. Imagine we come back here 2 years from now, and hopefully we will be back. What would be your measurement of success? How will you judge whether we've been successful from this day to that 2 years from now? Honorable Tedeschi?
So the primary health care, what we want to do now going forward is, one is building on what we have been working on, improving the quality and comprehensiveness of the services that primary health care delivers in the existing programs, but also move towards the integrated approach that Honorable Minister of Malawi is mentioning, including NCDs, a woman not getting family planning but not getting care for cervical cancer is not a complete service. So comprehensive integrated service, including mental health and other issues, and the crisis that we are looking at, responding to emergencies. But for this to happen, we need to see increased investments in primary health care. 2 years from now, if we collectively increase investments, both domestic as well as from our donors, we can improve and see the change that we see. And I would like to just highlight one quick example on that, where recently we have had a very strong family planning program, which is still strong, but have had challenges with decreasing investments from aid funds, because a large portion of it was dependent on that. So we had to mobilize both domestic and new donor resources, and with a compact, the government pledged or actually put in a new resource for the next 3 years of about $11.3 million by government only, which was matched by donors. So this is the kind of investment we want to see increasing jointly, because the sustainability issue is really when we are also pushing domestic investments to increase, as well as aligning our efforts for better efficiency and outcome.
Thank you so much, Honorable Minister from Malawi. Respectfully, 1 minute.
Okay, for us, I think what I would want to see in the next 2 years, as we're talking now, I have maybe one community health care worker serving about 15,000 people, which is not good enough. So what I would want to see in the next 2 years is I come here and that ratio has been reduced by at least 10 or 15%. Thank you.
It's a deal. Atul, anything?
Yes. So how will we measure success?
20 seconds.
In the last 3 years, we have lost global life expectancy, the first reduction in global life expectancy in 70 years. So the success will be that we will have recovered life expectancy signified by the commitments that G7 and others made, that by 2025, end of 2025, we will have recovered the life expectancy reflected in the percentage of deaths occurring in women under 50 and children under 5. We should see that proportion go back down again and continue to improve.
Ladies and gentlemen, the only man amongst the women, and of course you extraordinary women, a round of applause for my panelists. Thank you so much. Thank you very much. Thank you so much. Thank you, Honorable Minister. We have only a few more minutes to go, but I promise to make them memorable. Ladies and gentlemen, please bring to the podium with a resounding round of applause our next contributor, who is going to be talking about a pledge. Please welcome Miles Kempley from SIF. Thank you, Miles. Thank you so much. Please, go ahead.
Why. SIF's focus is all about backing scalable solutions for health and nutrition delivered by strong partnership platforms that are country-led and have commitments to accountability, including the role of civil society. It has never been more important to scale investment in women and girls, which we know are amongst the best investments that a country can make. And this is why we're backing the GFF. Like you, we are outraged that the investments in health and nutrition of women, children, and adolescents remains so underfunded. It is morally unacceptable that hundreds of thousands die in childbirth or from unsafe abortion each year. It's an outrage that hundreds of millions of young women have an unmet need for contraception. If we are to achieve our shared goals, especially to make universal access to SRHR a reality, then we need to do things differently. I'll give an example. The funding gap for contraceptive supplies is persistent and growing. This year, it is $100 million. By 2030, it'll be over $200 million. This means that in some countries, 40% of health facilities are stocked out of contraception. Health workers have to ration these life-saving choices. And most importantly, women and girls leave without the choices they deserve. This undermines our efforts for dignified and rights-based approaches and to leave no one behind. So we, therefore, at last month's UN General Assembly, deeply welcomed the announcement of a bold partnership between the GFF, UNFPA, and national governments to work together on ending this funding gap. This has the potential to change the way supplies are funded from being highly donor-dependent to being country-led and integrated. This demonstration of partnership, plus our deep confidence in GFF's leadership, is why CIF has decided that we will double our commitment to the GFF to $50 million. We call on partner countries to take full advantage of the GFF to achieve their goals, and we encourage all funders who have yet to commit to redouble their efforts to this country-led partnership. Thank you.
Thank you very much. And the amount keeps going higher. I'm liking it. I'm liking it. If everybody comes up here to quadruple, we will get to our 800 million in no time. Sif, thank you so much for that. Ladies and gentlemen, we have one last panel before our last few speakers, and we're talking about unlocking resources and accelerating impact, delivering the future for women, children, and adolescents. Please allow me to bring to the stage Honorable Minister Professor Awa Marie Kolsek from Senegal, a Minister of State at the Presidency. Also being joined by UNICEF Executive Director Catherine Russell. Last, definitely not the least, President Global Development of the Bill and Melinda Gates Foundation, Chris Elias. All right, so sadly, you are the panel that gets only one question each. Not because I don't love you, but because we've got to move to the next session. I apologize. Minister Kolsek, let's start off with what you have invested in healthcare throughout your career and what you think works best with heads of state, ministers of finance, and international funders.
Thank you for this question, and because of the time, I will go directly to the point. I would like, first of all, to say that all my life, and I think it's a long life, I have been involved in this type of discussion, investing in health. But what I can say is that it is always, it is a good idea, it is very smart. But at the end of the day, it is not moving as I want. The second is that often people are looking at health as an expense and not investment. And it has been all my career, the fight I have been doing to be able to have at least enough money to do the job. When I was Minister of Health, it was that, and hopefully I had the president who was very supportive, and we almost now double our budget on health. So it is just to say that you need to advocate, but you need to have high-level commitment, high-level will, but also leadership. This is for me very important. And if you have it, Minister of Finance often will follow. But if you don't have it, it is always a discussion and a negotiation. So this is for me really the first point I think that I have learned. We need to have high-level commitment and will. The second point I can say also is that we need to look at health not only on the health sector, but open it to all the sectors. And this multi-sectorial approach, but also the interdisciplinary approach, can help also to advocate for more money, and also to pick money elsewhere. because they are doing also health, but it is not put on the bill when we say that this is an investment on health. Another point is just strengthening health system. It is always that. We say every year, every meeting, everything, but it is important to put it clear and to make it happen. It is not normal that the health system is always broken down in our continent and in our countries as soon as you have a crisis. We look at COVID-19, we were lucky not to have too many cases, and I was thinking if we had the cases they had in the US or elsewhere, I don't know what we will do, because the health system is still fragile, and we need to work on that and to invest. My last point will be, it is why we are championing really the global financing facility. I am not a person who is saying, well, it's good always because I want to please people. I have been, when I was Minister of Health, we started the global financing facility in Senegal. And it was the time where I have never seen such involvement, commitment of all the actors. All around the table for our investment case, but also after to do the plan, to look at the budget, what you put on the tables. The government will put this. UNFPA will put that. The USAID, other will, everybody, but it is not vertical program. You work all together, and this was very important. I wanted to say that this is why we are supporting also this type of initiative, which is country-led, and this is important.
Beautifully Thank you. Said. Thank you so much, Honorable Cosette. Thank you. And Kathleen, I want us to talk about the issues that remain underfunded and require increased investment to ensure health equity.
Well, let me say this. Health equity, I think, has to be seen in the broader context of equity, which is to say that the challenges we see are related to conflict, to poverty, to real challenges that these countries are facing, and we have to make sure that every child, every woman is covered by these things. From the perspective of UNICEF, we work everywhere, right? So we see that it's incredibly important to protect children's rights, the rights of women, and that good governance makes a big difference here. And I think this idea that we were talking about earlier, of it being country-led, is absolutely critical. Countries know what they need, they know what needs to get done, and we need to be there to help them. From the UNICEF experience, we would say one of the most important sort of revelations, but really you heard about it from the two ministers on the previous panel, is this notion of community health workers. Why? Because they are in the communities. They know what people need. They can provide frontline care. They can make sure that we know if disasters are on the way. And the thing I love most about it is it also is a way to employ women and to make sure that their status is higher in communities. So it's a really a great intervention that does so many things at one time. And so we're excited about that, and we think it's a way to really try to move the primary health system forward. As the minister just said, we've been talking about this forever. It's really hard to do it. It is hard. We know we need to do it, but these healthcare workers make a difference. We see it every day, and I think we need to support them.
Thank you so much. Chris, the Gates Foundation has long championed women and child health, and as well as being our partner. So why is this space so important for you to invest in?
So thanks, Anita. I think you've asked me the simplest question of the afternoon. I guess you saved the easy questions for the men. So, you've heard from Kathy and Inga about the needs for children. You've heard from Chedu and Natalia about adolescent needs, and from all the ministers about the unmet needs that remain in women's health. So there's a big need. The other thing is that we also have lots of solutions. Solutions that have been delivered in many settings, but not all. And consequently, we're not waiting for the solution to arrive. We have the solution. And we also know that those solutions can be delivered and scaled pretty rapidly. I'm here on the panel with my colleague, Awa Kolsak, who, during her time as Minister of Health, led Senegal's delivery of so many solutions, whether it was the informed push model for contraceptive supplies, et cetera. And the indicators that have of progress, I can't recite them as precisely as Atul did in the last panel, but Senegal is an exemplar in how to deliver a comprehensive set of services for women, children, and adolescents. So the easy question is, why do we invest in these issues? I'm usually asked the tougher question of, why don't you invest in X or Y? And I have to say, well, because we invest in children, women, and adolescents. The harder question might be, why do we choose to invest in the Global Financing Facility? As you know, we invest in a wide range of issues, Gavi, the Global Fund, the Global Polio Eradication Initiative, et cetera. And, just to bring together some threads of this afternoon's discussion, I think there are three key reasons that we invest in the Global Financing Facility. One is the leverage. Juan Pablo talked, very articulately about how the relatively modest resources of the Global Financing Facility leverage considerable other resources within the World Bank. And not only, that leverage with IDA or IBRD, but also help to influence the bank's operations so that a higher proportion of them get focused on this issue of children, adolescents, and women. Secondly, has been the alignment. And I think this is in some ways the most powerful message, most recently from AWA, but also from Ministers Jala, Tedessa, Minister Chapando from Malawi. The consistent feedback from countries about the GFF is that this is aligning with their plans. And as a consequence, it's also leading to the third reason we invest, which is sustainability. Because as it aligns with country plans, it has increasingly focused on primary healthcare systems that build the base for success, not just in delivering the interventions for women, adolescents, and children, but also for many other things. And so for all those reasons, we invest in the Global Financing Facility as a specific way of achieving these unmet needs on these important issues. And so in that context, I'm very happy to announce today that we're extending our commitment to the GFF. Our prior pledge went through 2024, so we'll commit an additional $37.5 million for 2025. That brings our commitment for this two-year period, 24-25, to $75 million. And we look forward to the independent evaluation and the investment case that'll be developed for the next replenishment cycle, where I hope we'll all be on this stage again. Thank you.
Thank you so much to my panelists. $37.5 million from the Bill and Melinda Gates Foundation. Honorable Minister, thank you so much. Thank you so much. Thank you so much. Thank you very much, Chris. So Gates Foundation, $37.5 million. I'm very tempted to ask Chris to take it to $40 million, but I might be pushing it. So we'll just keep it at that. Thankfully, he didn't hear me. Ladies and gentlemen, we are strictly pressed for time, but I would love to bring to your screens a word from the Deputy Minister for International Development Canada, Christopher McLennan.
Hello, everyone. My name is Christopher McLennan, Deputy Minister of International Development at Global Affairs Canada. Thank you for the opportunity to speak today at this important event. Let me first say how proud Canada is to be a founding and leading donor to the Global Financing Facility to help advance the health and well-being of women, children, and adolescents around the world. We're proud for many reasons. The GFF plays a critical role in ensuring that reproductive, maternal, newborn, and child health and nutrition issues are prioritized. As we all know, this work became more crucial than ever during the pandemic to help governments strengthen health systems and emphasize primary health care for the poorest and most vulnerable. Second, the GFF has a unique ability to leverage and catalyze World Bank financing towards essential, but underfunded, areas such as nutrition and sexual and reproductive health and rights. Third, the GFF ensures that their processes are country-led, which leads to strong partnerships and better outcomes. In fact, this approach is very well aligned with Canada's feminist international assistance policy and our 10-year commitment to health and rights. That's why we are pleased to have already committed $630 million to the GFF since 2015 to advance health priorities in 36 countries. This commitment includes $50 million a year over the next 3 years to support the GFF to successfully execute its 2021-2025 strategy. Because we understand that investing in women and children is one of the most impactful actions a country can make, we encourage other donors and private sector partners to consider extending the time frame of their support. Predictable and longer-term funding is fundamental to achieving results. National health systems continue to recover from the COVID-19 pandemic, and conflict and climate change continues to impact health, nutrition, and food security, all while global opposition to women's rights grows. That makes our investments through the GFF more important than ever. I thank Côte d'Ivoire, the Netherlands, Germany, and the GFF Secretariat for their efforts in this resource mobilization campaign. Thank you.
Thank you. And now, ladies and gentlemen, the State Secretary for International Development, Ministry of Foreign Affairs, Norway, Bjørk Sandkjær. Hi, Bjørk.
Dear friends, great to see everyone here, united to realize the right to health for women, for children, and for adolescents and young people, to ensure that we have just and equitable societies where we deliver on the promise to leave no one behind. I thought I would take you briefly back to 2015, at the end of the Millennium Development Goals, when we took stock and we saw that we had made great progress, but we were really lagging behind on maternal health, as well as neonatal and child and adolescent health. And that's why Norway, together with other partners, also present here, wanted to work with the World Bank to see, can we create a new facility, a new way of working, building on the experiences that we had made to help realize these very, very important goals. I think GFF has shown us that it is possible to work to promote sexual and reproductive health and rights, while also working and aligning with countries' plans and priorities. Both of these are important goals for Norway in our development policy. Let me deal with them one by one. Sexual and reproductive health and rights and gender equality. We've heard from speakers earlier today how, while we have made progress, we are experiencing pushback in this area. This is completely unacceptable for us. And that's why we are putting this very high on our agenda. We keep mentioning it in any forum that we are part of, and we know that we have good allies in this room to help further sexual and reproductive health and rights and the important agenda of gender equality. The second, health systems and aligning to countries' priorities. GFF has really helped us show that this is possible, to align as donors, to work with partners, and I would like to mention not just countries, we're working very closely with civil society, with our multilateral partners, with other key partners to support systems. We saw during the COVID pandemic, and I would like to admit, we can be proud as a global community that we mounted a very strong response. But maybe for some of us, and we'd like to admit, we were focusing on short-term results, and we were not focused enough on strengthening the systems. That's really where we need to move as we move forward. And that's why Norway, as part of our engagement, co-chair an initiative called the Future of Global Health Initiatives. Several people in this room have been involved. We've had some very good discussions during our couple of days together here in Berlin. We will continue to work on that. There will be recommendations in December, and we will continue to see how we can really make sure that we rally all the partners in global health to support countries' priorities and plans in a joint and integrated approach. And GFF, adds value to this work, and I think GFF has really proven its relevance and importance in moving forward on this very, very important agenda. We believe the approach lays the grounds for more sustainable financing, including domestic resource mobilization, and we heard very strong statements from ministers of health on this podium before me. And I'm very encouraged to note that for every dollar spent for GFF, countries allocate on average $7 to $8 from IDA credits for the same purpose, and more than $9 from their own budgets. So I know that you may be looking for me now to say a number of Norway's commitment. So I'm here to say that we are still negotiating our budgets. I don't have a number for you right now, but I would like to confirm Norway's continued commitment to GFF, and that we will stay the course and engage actively as we work together to ensure rights for women, for young people, for children, and to make sure that we deliver on our promise to leave no one behind. Thank you.
Thank you very much. Thank you very much, Björg. And I will hand over the last words to Juan.
Thanks, Anita. And very quickly, we welcome, we appreciate, and we thank these incredible commitments from all partners, from donors and countries, from civil society in their own way. They all strengthen the GFF. I'm very pleased to inform that in 4 months, we've been able today to bring these pledges to $445 million and more to come. So we've gone already over half of our target, and I'm sure that with your commitment, with the ongoing conversations, with new partners also coming in, we will not only reach, but surpass in the coming months this target that again helps strengthen the GFF, its model, its partnership, and most important, the leadership of our countries improving the health of children, adolescents, and women. With that, we bring this event to an end. Let me invite quickly all the speakers and donors to come up for a photo that is going to be there for our memory. Anita, thanks so much.
Ladies and gentlemen, thank you very much. Stage, please. Can we have our speakers? And I can see that the next session is gliding through. Ladies and gentlemen, on that note, we thank you so much for your time, for your contributions, for your energy, for your interest. And more importantly, as we've talked about being here a year or two, we hope that you will go back to your organizations and your governments and you will prioritize the health of our women and adolescents around the world and support the GFF. Thank you very much. A round of applause.